Hello everyone, so this is our part 2, test taking strategies. So again, test taking strategies is one of the most important things you have to go over before you take your NCLEX. And I always remind my students, even though they're not taking NCLEX yet because they're in medical surgical nursing, is I always tell them, hey, you have to review your test taking strategies at least 30 minutes before you take the test. Okay, just to remind yourself that you prepared, you're ready, you studied so much about the different concepts. Now you need to learn how to apply what you learned. So when it comes to test taking strategies, is the first thing you really have to look at is to make sure you read the entire question, but only the question. Okay, what do I mean by this? There are times that I notice a lot of students and a lot of, graduates, they're preparing to take their NCLEX, and yes, they will read the question, but then they will just move on and answer it, but not really paying attention on what the question is really asking. So it's very important that you read the entire question, okay? And remember that when it comes to the questions is that when you break it down, the first part is the case related information about the client. So for example, it tells you your patient has heart failure, or your patient has mitral valve disease, or mitral valve stenosis, or your patient has COPD. It gives you this case telling you, okay, this is an oxygenation problem, or this is a circulation problem, okay? Second part of the question, when you look at it, is that, remember, the first two parts are usually called the stem of the question, although technically the second part is the stem of the question. So the stem of the question, that's where you will see some keywords, strategic keywords that I will show you later on, which also gives you a hint on what to answer in that specific NCLEX question. The third part would be the options, whether it's A, B, C, and D, whether it's A to G, A to H, if it's like all that apply type of questions. Remember, do not speed read. We have this kind of habit sometimes that you speed read and you miss few things in the question. That's a no-no. And remember to resist the urge to choose your answer based on a specific real-world experiences. Remember, your NCLEX is about ideal world. So it's not about what you're doing as a nurse aide or what you're doing as a nurse technician, or let's say you're a patient care technician and you're seeing nurses doing such things that is not an ideal. So remember to refrain from that because you have to think of ideal world, okay? So as you can see here, this is a sample question. So I'm gonna give you a minute to think about what this question is, okay? Okay, it's pretty much almost a minute. So I'm gonna show you when it comes to this question is I changed the font color of the things you have to take note of. So again, the case here is about a patient that has metastatic cancer, receiving morphine, continuous IV, and it's asking about the toxic effect. So you see, so when you are reading a question, that's what you need to do is to look for specific keywords that will help you to answer a question. And in here, what do you think is the answer? The answer is skeletal muscle flaccidity. And as you all know, morphine is an opioid. It's a narcotic. And again, when you're giving this type of medication to your client, you have to be very careful on its adverse effects. And when you're looking at the question again, it's asking about adverse toxic effect. Okay, because some of you might be choosing letter A or letter B. When you look at A and B, they're pretty much similar options. You eliminate them. Remember, that's also one of the test-taking strategies. Now, second is reinterpret the question to identify the core issue. This is very important. You have to take a moment to reword the question in your head to help you identify the core issue of the question. When you say core issue, it's about specific skills, ability, or point of your knowledge that is needed to make the correct answer selection. So this is an example, okay, about the core issue of the question. This is the sample question, as you can see here. This is about a 39-year-old female client scheduled for discharge following right mastectomy with breast reconstruction. The nurse places highest priority on teaching the client which point before discharge. And then, remember, you have to reword this in a way that you understand it. So, the reworded question item would be, what is the most important client teaching point for a client going home after mastectomy and breast reconstruction? You see that? You have to reword it to be able to answer it and to look for the core issue of the question. Because there are times we add stories to the question, which you don't want to do. Because with that, you will miss the question. Next is focus on the client in the question. Okay, so as you read the question, deliberately determine who is the real client and choose the option that helps you to answer accordingly. Okay, because there are times in the question you will see that they'll give the patient and then they'll give a family member who's acting up, or the wife doesn't want to listen to what you're teaching, just to distract you from what the question is really asking from you. Okay, so you have to be careful on that. Find critical words in the question. This is very important. Critical words, it helps you to discriminate what you need to focus on while answering the question. Okay, like for example, when it comes to time, probability, the sequence of actions, or priority setting. This is what I was telling you earlier about strategic keywords. Okay, we also call it critical words. These are the words that you need to look for in a question that will give you a hint what this question is all about. Like for example, this one, right? Again, look for the STEM, the critical words or strategic keywords that you need to be able to answer this question. I'll give you a minute. All right, so I know it's a few seconds. When you look at it, these are the things you have to make sure you take note of to be able to answer this question. And you might be choosing a different ones. But remember, the word initially will give you a hint. Okay, what would you do initially, or what would you do first when it comes to this type of patient, right? And in here is A, identify the cause of frustration. Next is be alert for words that are red flags. Okay, red flags means something that you need to be warned of, something that you need to take an immediate action. So as you can see, remember, we do not live in an all or nothing world. And nursing practice is not an all or nothing endeavor. Okay, so example would be all, every, none, never, always, cannot, must not, and only. Words that oversimplify the decision-making process in nursing practice. Remember that once you see this right here, okay, they are not the answer. Okay, however, when you see this, often, usually, likely to, probably, then this could be part of a correct choice. Okay? Next would be identify positive and negative words in question stems. So in here is, it helps you decide on what option to choose depending on the question. Like this one, it tells you that this is a positive statement. You know why? Because of the word understands. And you can pause this video to double check, scan this question and see what do I mean by positive. Because again, positive means it tells you that this client understands discharge instruction. Okay? Well, with negative, I'm going to show you. This is a negative wherein you're looking for an option that tells you that this patient needs further instruction. Okay? All right. Next would be eliminate incorrect options. So if you think that letter B and letter D are incorrect, just eliminate them. Now you're down to 2 options. And on those 2 options, use your test-taking strategies. Remember to carefully examine options with similarities. And earlier I showed you one that if you see similar options, and you might be wondering, why did I say dizziness and sedation are similar options? Because both of them are about the level of consciousness of your patient. Okay, that's why those 2 are kind of similar and you have to eliminate them because they are not the correct answers. Now, I know this is quite a bit long, but remember that any similarities between the stem and the option, there's a possibility that it might be the answer. Okay, but if you look at the options and there are 2 options that are kind of the same thing, but just using different words, eliminate them. Okay? Remember that this strategy can be applied to communication processes, interdisciplinary care, or taking an action in an emergency. Okay? This is very important, guys. Next is recognize the need to prioritize. And you know what? A lot of people think that when it comes to prioritization type of question, it's a trap. But it's not a trap, guys. You just have to know how to answer them. Okay? Because as a nurse, we will be experiencing a lot of prioritization and delegation in our decision making. So you need to learn how to answer these questions because technically when you start your clinical practice, you have to do it. Okay? So in prioritization is, again, this is a type of analysis, the level of difficulty of the question, and you have to decide what is best for your patient, okay, or what is the best response for that situation. And you'll be using either Maslow's hierarchy of needs, ABCs. You have to look for a keyword like least stable or most at risk for complications. You have to look for the time. Can it wait or can it not? Is this a stat order? Assessment and teaching. Are we looking for an option that is about assessment or this question is about teaching? Okay. Next, another thing that I can show you about prioritization, if you think that the previous one that I said was a little bit confusing, is as you can see, what is heavy? This is like a seesaw application, I would say that. So as you can see, the heavier would be this area right here, right? The ones are in red, okay, font color. So like for example, when it comes to assessment, you have to prioritize, you need to use ABC, airway, right? Airway first before you prioritize breathing and circulation. Any compromise in airway, that's your priority. Any patients who have acute onset of condition, like acute heart failure, acute kidney injury, that's your priority. Any patients who have an acute onset of disease process, they're unstable, guys. Okay. Early findings, old and young, these are your priority. Interventions. When you're applying your interventions, remember that you always start with least invasive before you get to the more invasive. And your priority is to do it fast. It needs to be patient-centered. I use Maslow hierarchy of needs. Remember, the physiological need is our priority. Okay? Assessment is more important than intervention. Of course, you need to assess your patient first before you do something. Okay? Safety of the patient is your priority. And the rest in here are not your priority. Okay? I remember before a student asked me, what's your priority? Is it the pain or the one who's crying? Technically, the one who's in pain. Okay? Because emotional need is actually least of your priority. Okay? Because again, physiological need is your priority. And to make that patient comfortable. You can also use THIN thinking. THIN stands for top 3 needs or top 3 questions that reminds you, hey, this is my priority. Or if the patient needs help very quick, or identify the risk or safety of the patient and use nursing process. Remember, assess first before you intervene. I just want to show you this Maslow's hierarchy of needs. And probably you remember this way back when you were taking your fundamentals of nursing, or not health assessment, but I believe fundamentals of nursing. And this is a very important, theory that you have to make sure that you prioritize the physiological need of your patient. And as you can see here, Abraham Maslow, he studied, positive human qualities, and this is way back 1954 when he created this. Okay. And as you can see here, self-actualization is actually a person's motivation to reach his or her potential. And for that patient to get to here, that patient needs to meet physiological need. And again, Maslow's hierarchy of needs, I want to correct myself, is not a theory. Okay, it's not. And I think I mentioned it's a theory. It's not. It's an ideology that Abraham Maslow created. Actually, technically, way back in 1943 in his paper, A Theory of Human Motivation. But 1954, he created this. Okay. This is another example of questions, and I will let you guys try to answer this. Okay, and you can pause the video and try to think about what would be the answer on this one. This is the answer. These are the strategic keywords that you have to look for, and this is the answer. Okay. Now use the nursing process effectively. Okay, it means that make sure you assess first before you intervene. Always be positive. Additional tips for NCLEX-RN test-taking strategies, like this one. Before any client contact, always do hand washing. Remember that treatment and procedures are always explained to the client, not you, but the surgeon. Any confusion, you have to call the healthcare provider. Okay? Remember, any invasive procedures, it needs consent. And for pharmacology, NCLEX-RN questions these are some tips that I can share with you that for sure you've known this when you're taking nursing pharmacology in your nursing school. And more of nursing pharmacology tips. So thank you so much. I hope this part 2 test taking strategies will help you to pass your NCLEX. Again, if you have any questions, post it in my YouTube channel as a comment so I can reach out to you, or post it in my page. Okay, don't forget to hit like, comment, and subscribe. Thank you guys.